Welcome back to Health Unplugged, our superstars, where we bring leading medical experts into conversation that help you understand your health better before the problem becomes severe. Today's topic is about something that almost every one of us has experienced: a blocked nose that will never clear, a common cold that doesn't even go away, difficulty in breathing while sleeping, or a facial puffiness that just doesn't go. For some, it's just an occasional inconvenience. For some, it just becomes a part of their normal life. Someone just tries to adopt to the situation. Many people just simply adapt. Some says that I always have a blocked nose. Someone says that one side of my nose is always blocked. I have difficulty in breathing. I have always had sinus. But should we really accept these symptoms as normal part of life, or are they concerning parameter that we should think about? There are a lot of home remedies that are available and people usually use those home remedies. But we are here to find out if these home remedies are just helping the treatment of sinus or just delaying the proper treatment of the disease. We also need to find out when a common cold becomes a sinus. With a lot of modern technologies in ENT science, whether the sinus can be treated easily or there are a lot of things to be explored. To uncover all these facts related to sinus, we are joined by Dr. Rahul Aggarwal, ENT Specialist, Senior Director, Max Hospital, Vaishali. So, Doctor, welcome to our podcast, and we are really delighted to have you to converse on sinus problem.
Thank you very much. This is a basically it is very. I can be grateful to you that you have given me the chance
Okay.
to make awareness about sinusitis among people, and I welcome your act.
Thank you so much, sir. Let's start with the first segment where we will uncover the reality of just a common cold. So, doctor, usually people think that I just have a normal cold which will go away in a certain period of time, but they actually don't know what is happening behind their face or behind inside. So, can you just walk us through the entire process and why people are just diagnosed with common cold, which later turns out to be a sinus?
See, basically, cold can be divided into three segments. Most commonly, people suffer from viral cold. That is a
Okay.
viral infection,
Right.
which is a self-limiting cold.
Hmm.
So that is one of that perceptions which people create that
Hmm.
cold gets treated by itself because there is no antiviral available.
Okay.
So the most of the viral infection, even the latest COVID,
Hmm.
used to start with a cold,
Okay.
upper respiratory tract
Right,
infection.
right.
So, and it is a self-limiting disorder. Most of the viral infections are self-limiting. They resolve within 3 to 5 days or
Correct.
7 days. So that is where the perception starts that cold has no treatment, and you need no treatment for cold, and it gets treated by itself.
Right.
But except than that,
Hmm.
even that also sometimes require treatment. Other than that, common cold, then we have allergic cold, which are the allergies which are rampant. Again, allergies can be quantified into grades of allergies. You
Right.
have a mild allergic rhinitis,
Hmm.
moderate or severe.
Hmm.
And these allergies can finally lead to certain complications, which can, in a layman, be termed as sinusitis.
Okay.
Because sinus and nasal allergy is single cavity. It is a
Okay.
common mucosa you have.
Mhm.
So once you have an allergy or a viral infection or any other inflammation, it is common to both nose and sinuses.
Correct.
They are not differentiated into in the medical language.
Okay.
But for a layman, how to distinguish whether this is still rhinitis, not sinusitis? So rhinitis leads to complications which cause
Which
sinusitis,
causes? Okay.
and that the symptoms will tell you. So you need to consult a doctor how prolonged the symptoms have been,
Hmm.
and plus the associated symptoms
Okay.
with the cold. You have fever, body aches,
Hmm.
headaches, what all, weakness,
Okay.
lethargy. So this all correlates whether you have allergies or you have a infection, viral infection, plus the recurrence rate.
Okay.
How frequently you are suffering from that.
Okay.
One patient will tell you that I have daily sneezing
Hmm.
with no other symptom,
Correct.
no body aches, no fever, nothing, but only
Sneezing.
So that might be allergy,
Okay.
but you need to see the picture in a whole. You need to examine the patient, then only you can decide. So, then further discussion will come to know other
Sure.
things also. But a common cold, first thing is you need to, any doctor or any patient needs to first of all distinguish whether this is a common cold,
Okay.
which is infective, viral,
Hmm.
then followed by allergy,
Okay.
or followed by chronic rhinosinusitis.
Fine.
So these three broad categories you can take up. There are certain more classifications to
Mhm.
add to it, but for a layman, these three broad categories should be ruled out.
So basically, there are a lot of contributing parameters that you assess before giving a final diagnosis?
Yes,
Okay.
you need a thorough history
Hmm.
by the patient, how long he has been suffering, what kind of symptoms he have. Then I've already told you the associated symptoms
Right.
he has or not. And then the examination parts comes, what we are seeing in his nose.
Okay.
And one more important thing is the anatomy of the nose.
Right.
Whether it is into the shape or not. There are a lot of features which cause certain complications to happen,
Okay.
which are you are basically more prone to it because of the
Anatomy
structure of your
nose.
nose.
Right. Okay.
That is one. So you need to basically distinguish between whether this is a common cold or you are suffering from allergies or you are suffering from chronic rhinitis. Yes, people take timely intervention, so allergies can remain allergies, not
Okay.
progress to
The next
chronic
one.
sinusitis.
Right. So the next question is, sir, what are sinuses and why does sinuses exactly exist?
See, sinuses are basically air-filled cavities
Okay.
which are draining into the nose.
Okay.
And anatomically speaking, if you see, they are on your three sides of the eyes. They are above your eyes, they are between your eyes, and they are below their eyes.
Okay.
So you have totally around 5 type of sinuses on each side:
Mm-hmm.
maxillary sinus, anterior ethmoid, posterior ethmoid, sphenoid, and a frontal sinus above your eyes.
Okay.
All these sinuses are ultimately draining into the nose.
Okay.
They are part and parcel of the nose. There is no difference between the mucosa of the sinus or the nose.
Okay.
They are basically have a lot of functions.
All right.
They have, see, the function of the nose is basically you are breathing from the nose. You have main function is breathing. Then you have the smell area in the nose, and during the breathing, the air you breathe is at different places at different temperature, different moisture. So what nose does is it brings the air to your benefit. It will moisturize it adequately. It will purify it. There are dust particles, there are infections. So that will the filtration process is happening in the nose. For that, the nose requires a very large surface area. So all these sinuses are basically having the mucous membrane, the mucus which gives the hydration, the ciliary mechanism which do the clearance.
Okay.
So all this is done by the sinuses and the nose into. Sinuses develop slowly.
Okay.
Small childs don't have fully developed sinus. All the sinuses are fully developed around 15 years of age.
Okay, fine. So there is a lot of science that goes behind whatever is we are
It's a
breathing
process
in.
of pneumatization.
Yeah, correct.
So the air comes, and you have normal bony structures also.
Yeah.
They happen to pneumatize, which should not be pneumatized.
Okay.
Your nasal septum can be pneumatized,
Yeah,
your
it's about
turbinates
to
can
ask.
be pneumatized. So they add to certain things. Sometimes they might be an incidental finding in the CTs.
Okay. So the next question is a related one. So how does a sinus gets affected? Actually, what happens when an individual gets a cold?
See, basically any type of inflammation, might be allergic, might be infected. It causes infection or allergy. Both are causing inflammation, but in a different way.
Okay.
We'll not go into that detail what different kind of inflammation they cause.
Hmm.
It is basically T1 immune system, T2 immune
Right.
system, but they cause inflammation.
Hmm.
And as I already told you, the nasal mucosa and the sinus mucosa are the same,
Same. Right.
and they're interconnected.
Hmm.
So what happens? They cause, whenever there is an allergy or an infection, the whole system gets inflamed or swelling. You can assume swelling. When there is a swelling happens, there is a defense system which comes into play.
Right.
So when the swelling, these sinuses are draining in the nasal cavity by ostiums, in small openings.
Yes.
So when the edema happens, these small openings get blocked or compromised. So there is happening a pent up of secretions in the sinuses.
Okay.
So which you can label it as sinusitis, inflammation of the sinuses.
Okay.
So sometimes what we do, we blow our nose, so you can clear those sinuses. You can do clearing by the breathing exercises, all kind of alom vilom and all breathing exercises, and rinsing, alkaline nasal douching can be done to basically clear these sinuses. This can help you out, but it takes time to inflammation to settle.
Okay.
There are medications which can aid you for the inflammation to settle according to the type of inflammation. So this is what sinusitis happens. It is basically inflammation of the sinuses leading to pent up of secretions in the sinuses.
Okay. So this
if they drain by themselves, it's good. If they don't drain, then the role comes of a doctor.
So this is the reason when someone has a sinus, they have the headaches or around the nose.
See, headaches can be because of various reasons in sinus, because of pent up secretions. Sometimes one is called as a vacuum headache.
Okay.
That is nothing because your sinuses becomes, the openings becomes blocked.
Right.
There is no pent up secretions at the present moment. Only because of the inflammation, the sinus ostias are blocked. So there is no ventilation drainage of the sinuses. So you have a headache.
Okay.
Most of the cold, initial 1 or 2 days, you will start
right.
feeling a headache.
Hmm.
So that is because of the inflammation and blockage of the
Blockage.
sinuses.
Right.
So there comes the role of certain medications. Decongestants help only in these few conditions.
Okay.
Nasal decongestant, which are commonly used during the treatment.
Yeah.
So they help the sinuses open up, they start ventilating and draining, and you will get relieved of your headaches.
So nowadays we hear very commonly that I have a sinus. So what are the main causes that an individual should not be ignoring to get a better treatment and quicker diagnosis?
See, in my practice, what I have encountered is there are so many patients, they are suffering from so many years, just a single notion that I have a sinus and it cannot be taken care of.
Okay.
And when I have investigated them, I have found no feature of a sinusitis.
Okay.
So that is a common intention that you have one symptom, you have a headache. Headache have a lot of reasons. You need to rule out a lot of things and even sinusitis before labeling it that it is a sinusitis.
Okay.
It is one of the reasons for headaches.
Correct.
And if we go by the literature, sinusitis does not have classical headaches.
Okay.
It is more of a heaviness around your eyes.
Right.
That is like अगर हम बोलेंगे पेशेंट को तो वो बोलेगा कि सर जैसे मेरी आंखों पे वजन रखा हुआ है.
Correct.
That is the most common feature that somebody should not ignore. There is a heaviness around my eyes. Then nasal obstruction definitely should not be ignored. Constant secretions flowing from your nose, which is not basically after 3 or 4 days like acute cold, common cold is not being taken care of. Then loss of smell should not be ignored.
Okay.
Then headache is one of them. If it is not being taken care even after he has been to specialist, not an ENT, neurologist or a physician, and still the headache is persisting.
Okay.
So then he should be taking care of these symptoms. So if jotting down smallly, blocked nose, flowing nose, headache, loss of smell, and if you see some mass coming out of your nose,
okay,
should not be. Nasal secretions which are not clearing up
should not be ignored. Okay. So when someone says that sinus problem is, settling on its own or खुद से ही ठीक हो जाएगा, so what is actually happening inside the nose if it happens or if it occurs over a long period of time?
See, we have discussed that कि जो अपने आप से ठीक होने वाला sinus है, that is more common, a common cold which we call as coryza.
Right.
So that is a viral infection which in most of the cases is self-limiting, might be 3 days, 5 days, 7 days. It gets self-healed, or sometimes they come to a physician or a doctor, he will give you some medicines just to clear up the nose, might be some decongestant, might be a painkiller for the headaches.
Correct.
Symptomatic treatment is more common in that kind of situation, which the patient gets relief within 5-7 days. But now comes the question that patient is not getting relief within 5-7 days. Then what is happening is that there is an inflammation in the sinuses. Either might be because of allergy, might be because of subtle infection which has been there in the sinuses, which is not getting treated. Third, I already told you the anatomy of the sinuses is leading to a situation where the sinuses are not able to drain.
Okay.
Now all these 3-4 conditions in combinations are leading to increase in inflammation of the sinuses. There are a lot of secretions because the defense will come to basically cure the inflammation. So you have a lot of defense cells, white blood cells accumulating at that places and causing a thick secretion happening at the place of sinuses.
Okay.
So that thick secretion which is not being drained, and there is a lot of mucus production, lot of collection which is happening, and the sinuses and the edema will start happening in the sinuses. So now that goes into 2 different directions depending on the phenotype of the sinusitis. Patient might develop a chronic sinusitis that takes around 12 weeks. If there is no benefit within 12 weeks of the patient, you label it that this is now a chronic situation.
Okay.
If it gets relieved, then it is not that chronic situation. So those secretions might lead to formation of polyps, the edema leading to hanging of the mucosa which forms polyps. Or closure of the sinuses ostia, I already told you, because of that edema is increasing and increasing, and then lot more of secretions and inflammations keeps on going, which is not being helpful by the home remedies and by the kind of treatment you are taking. Yes, I have seen into my practice that patients suffering from chronic sinusitis, they are ups and downs.
Hmm.
So sometimes they are having
Absolutely
too much
okay.
of problems, so they think, yes, I should consult a doctor. And when they just plan, they start getting some relief, might be because of home remedies. We'll talk about them, what kind of things will help you out in these situations, steam and all those things they are doing. So they have some relief, then they again say, it is, I'm getting relief. So
Better
they
now. Yeah.
drop the idea of getting a consultation or investigating it further. So this ups and downs keeps on happening, and finally they land into a situation which is not being relieved at all.
So, since we are talking about the sinus in detail, so can you explain what are the long-term effects on any body part, organ, or even in the nose? What is going to be effect on a long-term level?
See, sinus, we have two important things which sinus can affect. It is the local area, which it is there. The sinuses themselves are being basically affected because of all this happening chronic sinusitis. Then you have very important structures around your nose, your eyes. Then you have your brain. Brain is just sitting above the nose.
Correct.
It is forming the roof of the nose, and eyes are forming the wall of the nose.
Correct.
So any kind of sinusitis, chronic sinusitis, allergic chronic, I have told you that there are a lot of phenotypes and subtypes of sinusitis, and there are a lot of things which is affected. So there is a condition called acute sinusitis.
Okay.
We have discussed the chronic. Sometimes there is an infection, acute bacterial infection of the sinus, and the sinus get blocked, and that collection of pus is in the sinus, and it will expand.
Okay.
When it is expanding, it will affect your eye. So you can have the infection spreading into the eye.
Okay.
So the eye will get inflamed, you will have a swelling in the eye, the eyelids will swell. That is one of the acute emergencies. Very few patients will have, but all doctors should be aware about it, and patients should be aware. If you see a sudden increase in your swelling in the eye and eyelids, you should immediately contact a ENT specialist or an eye specialist, and he will examine that this is not because of the eye, this is because of the sinus, and you need to treat the sinus. This is one of the acute emergencies. But even in chronic inflammations, there will be the expansion of the disease to the surrounding areas, eyes and the brain.
Okay.
These are the two important structures. Eye, the structure of the eye, the orbit can be affected. You can have the infection spreading into the orbit, leading to the swelling of the eye, your displacement of the orbit leading to diplopia, double vision.
Right.
And the sphenoid sinuses, as I already told you, the eye optic nerve is basically going into the brain through the sphenoid sinus. So the sphenoid sinus, but it is in the bony canal. But the infection in the sphenoid can lead to erosion of that bone and affect your optic nerve.
Okay.
And then you have the other structures of the brain above the sphenoid.
Okay.
Or the disease itself can penetrate into the brain, leading to meningitis. Sometimes, very rarely nowadays, to a brain abscess also, or to the obliteration of the blood vessels in the brain. Okay. Second, these are the local effects. If you have nasal polyps, blocked nose, you will have snoring.
No,
that snoring will lead to problems in your lungs, in your heart, and in your day-to-day activities, because you are not taking adequate sleep. So you are not, basically your brain is not relaxing in layman, otherwise it is a broad. So the morning you get up, you have headaches, you are not feeling that you are up to your mark, you have relaxed, so you feel tired, so you are not up to the, and your physical ability of performing will decrease.
Right.
Your heart and lungs are being affected. Third is that your sleep, it gets disturbed. So your sleep gets disturbed, again your learning powers increase, you are not up to yourself.
Correct.
So you are not up to the full 100% which you can perform. Your performance will also come down. So these are the extra nasal effects into your heart. You can have it into your lungs and your whole body, the weakness, the lethargy. You can have all these things.
So many things too.
Yes.
So as we just heard, there are a lot of external factors that affects what we just call it as a common cold, and how it turns out to be a chronic sinus, and how it is impacting our body in an internal manner, and what are the different organs that gets affected if you don't get treated on a regular basis. So to consult a specialist doctor, to consult with Dr. Rahul Aggarwal, you can log on to One Health Assist website, and get a personalized consultation. So, when we are talking about the modern lifestyle or today's generation, what are the contributing factors that are affecting the sinusitis?
See, basically sinuses, we have already discussed that the sinuses are basically a clearing mechanism. Basically, they have that clearing mechanism. So they have a mucosa, that is the skin lining the sinuses. Over them, there is a fluid mucosal lining. Okay, that lining has ciliary action. There are hairs
Right.
in the lining which clears the mucosa, and that mucosa is what is trapping the air, the dust particles, the smoke, and the bacteria and viruses, and clearing it from the system. So it is basically a filtration mechanism. So anything which is affecting your filtration mechanism can lead to sinusitis. In the modern era, the most common thing is smoking, the smoke.
Okay.
Smoking is the most common one. So smoke per se damages your ciliary action.
Okay.
So when it damages the ciliary action, the mucosa does not get cleared. The mucosa and the mucoid secretions start collecting in the sinuses, and then they get infected.
Okay.
So you start developing more of inflammation. Smoking might be passive or active. You are yourself smoking, or you are basically inhaling smoke because of the environment. So these smoking is one of the primary things. Then pollution,
Yes, sir.
overcrowded places, pollution, humidity also. If you are too many people in an area and you are working in a very humid environment, that also affects your ciliary mechanism, your clearing. Then food habits.
Okay.
Food habits, late night eating. So you have reflux mechanisms. Your acidity, your acid materials is coming to the nasopharynx, the nose area, while you are sleeping. And if a droplet of it enters into the sinuses, again it causes inflammation.
Okay.
So in a lot of studies, gastroesophageal reflux has been associated very closely to sinus disease.
Okay.
So eating habits need to improve. Third is the sleep. Very important. What being ignoring in the modern day is the sleep. Proper sleep and at the right time also.
Okay.
So you should follow a schedule proper. I usually sleep at these times, and more I see the young people or the Gen Z now, their sleep is, they don't sleep before 1 or 2.
Yes, you're right. Maybe 3 o'clock also.
Yeah, there are a lot of people are working at night. So your sleep cycle is disturbed. You are sleeping at the daytime. You are being awake in the night, and a lot of people, not only they are awake, they are eating. Then again, it is a problem.
Absolutely.
And a lot of people, when they are awake, they are smoking.
Yeah.
So all these things are affecting your sinus disease. Smoking and reflux affects chronic sinusitis in a large way, and allergic, the people who are allergic already. So the pollution, the air pollution, the dust particles, all these things affect their allergies. So they lead to more of polyp formations, and this lead to a non-polyp kind of a sinusitis.
Okay. So nowadays, most of us are spending more time indoors compared to our previous generation, like office or house. So are these places better or worse for the sinus health?
See, it could be, I will say, both ways.
Okay.
If most of us are basically having indoor workplaces indoors, as I also I'm indoor most of the time. Either I'm a clinic house or the hospital. Hospital is also an indoor, totally air conditioned facility. So it could work both ways. See, if you are indoors, you are avoiding outside pollutants, you are avoiding air pollution, so you are avoiding all those irritants.
Right.
And sudden change of temperatures also. But if you are indoors, then you require the air hygiene. The indoor is very important then.
Okay.
Extremely air conditioned areas can be not good for your sinus health, because they again the moisture is too high. They again impact your ciliary activity of the sinuses. Okay. So you need a proper hygiene indoors. Again, accumulation of pollens in the indoor, dust mite, dust. So cleansing is not proper, air conditioning is not proper, HEPA filters are not in place. So all these will affect your sinuses, the ciliary mechanism, leading to sinus disease.
Okay.
Humidification increases fungal load.
Right.
So if AC filters are not cleaned properly in office places, so there will be a lot of damp areas
Correct.
which will be existing in the AC vents, and there will be a lot of fungal load there, and that will be released in the environment, and we are inhaling those very minute particles and causing inflammation and fungal allergies.
Okay.
Again, if you are not taking care of the home, dust mite is one of the very prominent allergens at home, and one of the most common cause of allergy worldwide.
Right.
So that is only indoors, not outdoors. So if you are not taking care of your bed sheets, pillow covers, and there is a highly humid environment in the home, that will affect your sinus disease.
Okay.
So it is both ways.
Both ways.
So you might be getting prevented, but if you're not taking care of the proper hygiene of indoors, then it will affect.
us. Yeah.
Second most important factor being indoors, physical activity helps clearing of sinuses,
Okay.
which is again stagnant if you are only indoors.
Right.
So you're not having physical activity, and if that physical activity happens, it drains your sinuses.
Okay.
So that is also because most of the people are having indoor, they're living basically more indoors. So when initial times you used to go to office, so you will travel a kilometer to the bus stop. So you'll have some kind of physical activity, which will drain your sinuses and prevent accumulation. That is what now most of the doctors are propagating, that you do breathing exercises.
Right.
That is for clearance. So I hear someone that a small child, newborn child, does not do breathing exercises. How are the sinuses? So he does not have sinuses, first of all, but he cries a lot. He shakes his hands. He'll move his legs. So he'll breathe more.
Okay.
That clears his sinuses.
Right. So
whatever they are, is the smaller size.
So this is the tip I think I will take home, because most of the majority of the day we all spend sitting in office
Yes.
and working in a stagnated position. So I think this
Yes.
will
So
be a
if you,
take.
but we can't help it.
Right,
I'll also
right.
say that I can't help it, that I cannot go outdoors to practice. But yes, then you need some time for yourself, for a walk, for a stroll, for a brisk walking. That too not in a closed environment.
Right.
But again, there are people who will tell you that I cannot go outside. There's lot of pollen load outside. I will inhale that. I will have allergies. There is a lot of dust outside. There is a lot of pollution. So you need to achieve a good balance.
Right. So will the climate change or worsening air quality fundamentally impact the sinus health over the next decade?
Definitely. What we are seeing is, in a lot of studies are also coming up, that the climate change is basically, what is happening is the air quality is deteriorating.
Right.
So you have more dust particles in the air, which all of us are inhaling, which is leading to a permanent kind of inflammation in the airway. So the allergies are on the increase, and not only they are on to increase, they are not being benefited with the treatment.
Okay.
So there is a shift in the type of allergy also.
Okay.
So see, we can discuss everything into this. So allergy can be type 1 allergy or type 2, type 3, type 4. So type 1 is more easy to treat and more easy to be taken care of. But other allergies are a bit difficult. So we are seeing a shift from IgE or type 1 allergy to eosinophilic kind of allergy, which leads to more of polyp formation.
Okay.
And that too, which has not been benefited with the treatment. The treatment you give, they are not being benefited. So now all of the doctors need to come out of their basically comfort zone, and we need to see the other modalities. We need to classify the kind of allergy the patient is suffering from. We need to classify the phenotype.
Okay.
Why is he not being benefited with the treatment? We need to see to it whether he is suffering from the different phenotype of allergy because of this air quality. And the studies are proving it, the coming decade is more difficult. There is increase in the number of pollen. The humidity is increasing. So initially there used to be a 2 or 3 months period of pollens. Now it is extending to 6 or 7 months.
Okay.
When it is extending to that grade, the inflammation not being settled at all. And the treatment is not getting effective.
Okay.
Patients are more commonly developing polyps, requiring more revision surgeries.
Okay.
So that kind of shift is coming. So that is increasing the more health burden to the society. Decreased quality of life index, loss of time, because you cannot work on those periods. So every year you go for a revision surgery.
Mm. Got it.
So then you have a loss of your quality life
Quality.
and also work life.
Correct.
So you lose that family life, you lose that. So that kind of a very drastic transition
Okay.
is seen, and there will be severe chronic type of phenotypes which will be developing,
Okay.
which needs more aggressive treatment, and you need to see what kind of treatment. All people cannot be treated with the same kind of treatment.
Okay.
So you need to look around that, and governments also need to seriously focus to prevent the climate change, and the citizens also. We also have the duty that how much we
You
can
can reduce kind of.
take an effort or contribute towards it.
Okay. What are the most uncommon symptoms that an individual should take care of when they want to discover that they are having sinus?
See, there are few kind of symptoms in which basically patient never imagines that he is suffering from sinusitis, and he is being then referred to us from the various specialities. The most common, I will not say that, is the upper jaw pain.
Okay.
So a lot of people with toothaches and upper jaw pain, they go to dentist and they get their teeth examined, and he'll say, no, your teeth are quite okay. I will suggest you just give a visit to an ENT specialist, because your molars, last teeth,
Right.
upper jaw, they are in contact with the maxillary sinus.
Absolutely.
So when the maxillary sinus get inflamed,
Hmm.
so you can have heaviness in the upper jaw
Hmm.
and sometimes pain also.
Okay.
So, but that happens in acute or
Mhm.
acute on chronic situations. Very chronic sinusitis and you are ignoring it, and there are accumulated concretions and debris or fungal concretions in the maxillary sinus, and maxillary sinus is expanding, then definitely you will have upper jaw pain
Right.
and sometimes loop tooth also.
Hmm.
So any person for without any reason having an upper jaw pain, loose teeth,
Okay.
teeth pain should definitely consult a ENT specialist.
Okay.
Then we have a posterior headache. And these symptoms are very specific to certain sinuses.
Mhm.
So posterior or the occipital headache sometimes is overlooked, and you're visiting various neurologists or people and you're getting treated for headache. Finally, then you get referred to us, and after certain tests and diagnosis, you found that you are suffering from sphenoid sinusitis.
Okay.
So sphenoid sinus is one of the deepest sinuses.
Mhm.
So when it gets blocked and there are collection in the sphenoid, it causes occipital pain. And is the back of
Back
the
of
head
the
you
head,
have pain.
right.
So nobody imagines that you are having headache on the back of the
Right.
head. That could be because of the sinuses.
Okay.
Then you can have bad smell
Hmm.
because of the secretions, study away secretions you can say, or
Mhm.
pent up secretions causing smell. Halitosis, basically medical word used for halitosis. And then you can have recurrent clearing of throat because the secretions, they are not cleared from the front, they are basically
Back of
dripping
it,
in the
yeah.
throat. So you keep on doing this just to clear your throat out of. Lot of people also feel that there is some fogging, they cannot remember certain things or they cannot learn, they cannot focus. You have a lot of students, I have a mild pressure like symptoms and I cannot focus on those things. Those kind of patients can also be suffering from sinusitis because of those collection, lot of toxins being released into your body because of those inflammation and the pent up secretions causing this kind of. And a lot of patients can also feel dizziness. I'm not into my full equilibrium. I feel that I'm shaking. But equilibrium or balance is also a part of ENT because the balance system is in the ears.
Right.
And that could be also one of the reasons, because eustachian tube is an integral part of the nose and also has the same mucosa and also gets inflamed because of the sinuses,
Okay.
leading to improper function of the eustachian tube and pressure sensation in your ears. A lot of time people have blocked ears and they come to us. I have blocked ears, I have allergies, I have sinus kind of situation. Forget that, that's not going to be treated. You treat my ears. And it will be very difficult to explain them that your ears will only get treated once your sinus gets treated. So these 5-6 things people should look: blocked ears, and you are not having eustachian tube, you are having dizziness also, halitosis, bad breath, post-nasal drip or recurrent clearing of throat, upper jaw pain, occipital pain. These are the kind of symptoms which you should look for.
Okay. Very recently, one of a very good friend of mine had headaches, constant chronic headaches. Then, as you said, heaviness, aankhon mein. So he went to a neurophysician. He went to a physician. He did CT scan. I think I will take this advice home that he has to consult a ENT specialist to
If he
get.
had already got a CT scan done, so
Yes.
there would be some evidence which have come up,
Hmm.
even in the brain CT,
Yeah.
because sinuses, few of the sinuses come on the brain CT also, so he can be taken care of that also.
Yes. So as you mentioned, the normal functioning of his work day was getting affected.
Affected.
So that's when I can tell him now that you need to go to a ENT
Definitely,
consultant.
definitely.
So many people have adopted to the changes like blocked nose or poor sleep or bad breath. So what is that one point when they have to realize that it is now going to become dangerous?
See, chronic sinusitis is a very, you can say, slowly growing inflammation.
Hmm.
So already in our talk we have discussed that a lot of people have ups and downs. So sometimes they feel now I should go to the doctor. Then finally they start saying that I'm getting some kind of improvement. So they just avoid it. But there are certain features which they should basically not ignore.
Okay.
So as we have already discussed that our sinuses are very close to eye and brain. So if the sinus inflammation is now extending to their eye, yani ki you have orbital symptoms coming up,
Okay.
swelling in the eyelid, proptosis, that eye is propping out, or blurring of vision.
Hmm.
These symptoms cannot be ignored. Then you have a headache which is not being improved at all, even with medication.
Okay.
And you know that you have been investigated that you are suffering from sinusitis.
Okay.
That should not be ignored, because sphenoid sinusitis, we have discovered the
Yes.
optic nerves are very close and important brain structures are very close.
Right.
So these are the few things. Even loss of smell
Hmm.
should not be ignored.
Okay.
A lot of people ignore that also.
Yeah.
But post COVID, I have experienced now anosmia is one of the prominent things that people are concerned for. Before COVID, nobody was concerned about the smell. But yes, post COVID, yeah, now we see a lot of patients presenting to us with anosmia. And we find a lot of them have nasal polyps, which can be taken care of. But if you have orbital symptoms and intracranial symptoms, then you
Yeah.
are in no condition now to ignore the symptoms.
Correct.
It becomes a semi-emergency
Correct.
to be treated.
So, doctor, before the patient would have come to your clinic, the patient would have definitely tried a lot of home remedies like steam inhalation, saline rinses, antibiotics, over-the-counter medicines, or even the treatments like haldi use kar lete hain. So, are these all going to be the contributing factors in the treatment, or whether they are harmful?
See, we cannot say that totally they are harmful. If you are suffering from acute coryza, definitely steam will help you. Rinse will also help you. Breathing exercises will help you. There are certain things which are done just to calm your body,
Okay.
like haldi ka doodh. This only gives you the relief in the body aches,
Right.
give you a proper sleep. Your nose becomes more ventilatory, so you definitely have certain benefits. But the question is, till when you will wait
Right.
doing home remedies?
Hmm.
So if you have a coryza, 3 to 5 days is enough. So more than 3 days is enough. If it is not in relief, you need a consultation, definitely. When you are suffering from chronic,
Hmm.
more than 12 weeks, then definitely you need to think out, along with these home remedies, you need certain specific treatments also.
Okay.
And investigations also, ki what kind of sinusitis you are suffering from
Hmm.
and what kind of treatment you require.
Okay.
So only drawback is that there is a false benefit, false belief that you are getting is that I will totally get rid of doing only
Home.
these things.
Okay.
So that might be a drawback,
Okay.
trying home remedies. Otherwise, most of them are giving you some benefit.
Okay.
Not total benefit, but definitely some benefit.
Some benefit.
Few of them are now an integral part of treatment, like alkaline nasal douching, steam, breathing exercises is an integral part of treatment of sinusitis now.
Okay.
Worldwide. So definitely they will give you, but you need to know the kind of sinusitis you are suffering from.
Right.
And then take the adequate steps.
So, doctor, decongesting nasal spray usually provide a magical relief in terms of sinusitis, but as a ENT specialist, often, warn their patient against overusing them. Why is that so?
See, decongestants definitely gives a magical relief to the patient, because what they do, they decongest the nasal mucosa and gives you a very good breathing,
Okay.
and that is to within minutes.
Hmm.
This happens. So definitely they have a proper role in ENT treatment. It is not there no without any role. They have a proper role in acute situations. They are the one of the most beneficial medicines to be used, but they cannot be used more than 4 or 5 days,
Okay.
because they have their certain problems. So decongestant, one of the problem is that reverse congestion. Once the effect of decongestant goes, your nose feels more blocked.
Correct.
So that is one of the very important. They have a habit forming situation. So people make it a habit of using decongestant. Even after they get relieved of symptoms, they will keep on using these decongestants. Okay. Third, they increase in blood pressure.
Okay.
So they are basically contraindicated in people who are suffering from hypertension. So these three things, habit forming and rebound congestion, because once the effect goes, there is more congestion you feel. These three things prohibit their use for a long term. Okay. So you can only use them for 3 to 5 days. In acute situations, definitely they are beneficial. Okay. But they have to be prescribed under strict supervision. Okay. You must be seeing there was an ad of decongestant coming on the televisions. Now it is no more, because it was a strong objections raised by the doctors, because it is a habit forming drug. It is a proper drug. It should not be sold over the counter. Okay. So doctor, are there any traditional Indian remedies that can be provided for a relief? See, I did my allergy training in Bangalore itself. So we used to have a yoga class also daily, 1 hour. So there are a lot of techniques in which you can basically clear your airway. Okay. And what we are discussing the whole time is that your airway is not being cleared properly, either the upper or the lower. So you get sinusitis. So breathing exercises, the best one is the Alom Vilom, definitely will help you in clearing your nasal airways and improve your ciliary action. Correct. Then is the Jalniti, if done properly, definitely helps you in clearing your airways, clearing your mucus, and basically decreasing the allergen load. Steam again is helpful in conditions when you have a thick secretions pent up in the nose. To clear them, steam definitely. But in patients we have severe allergy, sneezing, and a lot of rhinorrhea, steam does not help. So you need to select the home remedy in consultation with the specialist. Okay. Definitely will help you. We have discussed there are other things also, but they only calm down your body. So you have a relaxed sleep. Sometimes only sleep will help you. Okay. You had a proper sleep, you might feel lot better in the morning. Next day, yeah. So that, and because you are blocked nose, so you are not taking proper sleep, so you are not into your own. So that helps. So home remedies definitely will help in these ways. Humidification of a dry environment will definitely help. Very dry environment also basically dries your mucus. Correct. And increase in thick secretions and leads to more sinusitis. Increase in humidification also. Lot of people, they just take lot of steam. That is also not helpful. Okay. You increase lot of moisture, increase in fungal load, and all this can happen, and you increase the moisture in the room also. So the damp things will, and fungal spores will grow. So everything to an extreme is not good. Everything has some few benefits if done by proper directions. Adequately done. As we just heard that doctor mentioned that lifestyle changes can definitely make a long run impact on your life and even on treating the sinus. You can get in touch with the wellness experts, the lifestyle coaches, the diet consultant on One Health Assist website and set your lifestyle to the full. So, doctor, before visiting you, how often does a patient explore the information that is available on Google or on AI tools or even on search engines? And what is it that thing that is it really good to have that kind of information, or is it just deteriorating the treatment or diagnosis of the sinus issue? Basically, any AI tool or any information website gives you general information. Right. You will ask, I am suffering from cold, what can I do? What I am suffering from? I have blocked nose. What could be I suffering from? So it will give you only general answers. It's a general information it will give you, but it goes to too much of extreme. So either you become more afraid or you become totally relaxed. कि नहीं कुछ नहीं है, छोटा छोटा सा प्रॉब्लम है, और you become नहीं ये तो कैंसर ही है.
Yeah, it
Because
goes
that is
to
the
that
code.
level. Yeah.
That is what I experienced. देख के नहीं सर मैं गूगल में देख के आया और वो बोल रहा है कि मुझको कैंसर है. ठीक है. So that is what is happening is. So in patient it is creating, in his mind it is creating a chaos. Whether I should consult a doctor or not.
Okay.
So there is a confusion that is being created, that this information might be sufficient enough to take care of. So there's a confusion which is created. Sometimes it is very difficult to explain him that this is not a specific information you have received. This is a general information which is applicable in different levels to different patients.
Yeah.
With different symptoms. That and doctor can only do that.
Okay.
To basically categorize the information.
Correct.
This is good for you and this is not for you.
Correct.
But now to make him believe that this information was right for you, this is not for you, is very difficult.
Absolutely.
Because now he is biased. So now you are not taking an independent opinion from me. You are taking a biased opinion. I might be speaking the same language what he already knows, or I might be speaking totally the opposite of it.
Yeah.
So he will not take it easy. So that is what the confusion is being created.
So conflict हो जाता है वहाँ.
Conflict हो जाता है because आप biased हो.
Correct.
पहले कि मेरे को ये है.
So how do you clarify that, or कैसे patient
So
को
basically
counsel करते हैं फिर
that is what the trust comes in between. That if you trust the doctor that I am coming to the right person, that is more important. Sometimes you need to go for investigations now. Either they might not be required out of it. So you need to get them done and tell them that I might be saying with my experience, but this report is saying what is being seen.
Yeah.
Is
scientifically
so
backed.
Scientifically, medical based, that is what you call as evidence based practice. So this is what it is. But no investigation is foolproof. All patients need to understand, and even everybody needs to understand. Nothing is foolproof. Any investigation is saying that no. See, you might be suffering from allergy. Definitely, I get a CT scan. The CT scan should be absolutely normal.
Okay.
But your symptoms are there. That is why there will be written a line, kindly correlate symptomatically.
Yeah.
So you need to correlate each and everything. What are the history? What are the symptoms? What are the findings? And what does the investigation says?
So once you join all these dots,
then only you need to conclusion. Yeah. Out of that, it might help you to join the dots, the information which is available in the Google. But you have only one dot, so you can throw it in any direction.
Right.
Right. So that you say ki, I have a blocked nose. What could it be? So you give you
list of
big
things.
Answer. So how will you basically scrutinize it?
It's very important.
So that is very important. But I think in near future you will have redirected questions. So as blocked nose, he will give this. So he will start asking you other symptoms also.
Yeah.
You have blocked nose. Do you have fever? So he'll say, yes, I have fever. So he'll ask, do you have body aches? Is your nose flowing? Is the flow yellow or green, or it is transparent? So it will start asking counter questions. That is what people believe.
Yeah.
So now it will start asking the same questions as the doctor must have asked. But still it lacks the examination part.
Right.
It will not be able to examine. It will only the self-examination which you can provide. That is all.
And the human touch will also be
till date it is coming up, and we should take it in a good sense.
Correct.
Don't totally rely on it, but you cannot totally out.
Since we have already discussed about how a sinusitis get diagnosed, let's move to the next part and how the treatment can be decided by a specialist.
See, to treat any patient with nasal complaints, you need to categorize into basically what he is suffering from. It is suffering from a viral inflammation, acute coryza. He might be suffering from allergy, or he might be suffering from chronic sinusitis with or without polyposis.
Okay.
The first thing is you need to categorize the patient. So if you categorize the patient, you will require history, examination, and some investigations. The gold standard investigation is a CT non-contrastivity of nose and PNS.
Right.
It has lot of other, there is a questionnaires and everything is there. So this is the basic, you categorize them.
Okay.
That a specialist can very well do and categorize. Then the treatment starts. For allergic rhinitis patients, definitely they will require a long treatment. Allergy again can be categorized to mild, moderate, severe. If a mild allergy, occasionally you have sneezing or blocked nose, very small 1 or 2 day medications can help you out and you don't need to do anything else. You have a moderate allergy, then you need long treatment. And if you have severe allergies, then you need regular treatment, which is affecting your basically quality of life. Then it becomes severe. Then you need to take regular treatment for the and to avoid complications. That allergic rhinitis leading to chronic rhinosinusitis or polyps.
Correct.
If you take regular treatment for allergy, you will escape lot of complications. Eustachian catarrh, blocked ears, snoring, you can prevent lot of them, polyp formations, you can prevent lot of them, including rinses and breathing exercises also. Then we come to chronic rhinosinusitis. Again, there is a grading of that, whether it requires surgery or not. Not all chronic rhinosinusitis requires surgery. Lot of things can be treated with conservative management, but the treatment will go for long. That will be decided by the ENT after all the process I have told you. Once it has been decided that you require surgery, then definitely the surgery is quite safe surgery in good hands. It is depending on the surgeon, it is done in GA or local anesthesia. It can be done very well. So the only problem with the sinusitis, the surgeries are that you are working very close to the eyes and the brain. So there are known complications for the eye and the brain. This is not the right platform to discuss, but yes, all patients should keep in mind these are the known complications. You can discuss with your doctor about it and you will know. Even the complication happens, most of them can be taken care on the table and afterwards also. In very rare case, there might be a complication which cannot be taken care of. But there are also known of these. But all said and done, it is very, very safe surgery and very fruitful if properly indicated.
Right.
And nowadays we have come with certain modern medicines also. But those modern medicines, that is monoclonal antibodies, are coming up. There are 2-3 types of monoclonal antibodies which has come up being used for allergy patients, not for all. Might be polyposis is one category that might be benefited with them. Still, there one problem with them, they are very expensive and they are not to be for all allergy patients. You need to be the right patient to be using them. And an allergologist properly can only categorize you that you are the right patient to use those monoclonal antibodies. They are injectable forms. You can use it and you can totally get control of their allergy. Basically speaking, for any patient, if you are suffering from a severe allergy, round the clock, that is 12 months, 24 hours you have allergy and it is not being taken care by medications and this you have waited for at least 2 years of the treatment, then you become the patient indication for monoclonal antibodies. Only for allergies. Not for chronic sinusitis. It might prevent you to be getting converted to chronic sinusitis or polyps. But you cannot go and say, no, I want to take that. No, it is not that, it works that way. So a proper allergologist will only categorize you that you are the right patient to use those monoclonal antibodies. They are expensive also. And again, you have to take them also regularly. It is not only one shot. Might be a regular shot a month or a 6 months. That also depends how the allergologist will decide the treatment. And third is post-operative care. Again, post-operative care, the rinses and the breathing exercise and nasal sprays play a very important role. In modern medicine, there has come up with lot of, depending on the type of phenotype of the sinusitis, there are salts like microlides, budesonide, steroid salts and budesonide are available which can be mixed in your rinse and you can take the rinse with those medications which will prevent the recurrence of the disease, initiate your clearance, give better healing to the sinuses and they are not entering in your body and prevent with for the complications of the steroids and the long-term antibiotics and even antifungals also. Lot of people are using antifungals also for the fungal allergic rhinosinusitis in the rinse, not in oral.
Right.
So that is also coming up very good. Without these three medications also, alkaline nasal rinse is one of the very important part and parcel of the post-surgery treatment also,
Okay.
with the nasal sprays,
Right.
steroid nasal spray.
Since we have just discussed about the treatment, let's move to the next part where we want to understand what are the modern advancements that are coming up in the field of ENT and how they are going to be impacting the overall
See, we
sinus
have already
treatment.
discussed the modern impact, the monoclonal antibodies, what is supposed to be the future of modern science is monoclonal antibodies, targeted therapy. So
Yeah.
what it is that it identifies that this is the cell which is at fault.
Correct.
So it will target that cell only. That is what is upcoming, is what is known as monoclonal. Mono means only single target है उसका. तो उसका उसको एक marker मिला हुआ है and it will attack only
Directly
that
on
marker.
that, yes.
To say it is very easy, it will attack only that inflamed cell, so no other cell will be affected. But it is quite possible that those markers are also present in normal cells also.
Right.
So they will also destroy those normal cells also.
Mm-hmm.
So till date, it is not like that it is totally safe. It is a very reserved drugs, very expensive drugs. But yes, as the time comes, we are getting more and more improvement. In a lot of our discussions in conferences, there will be a time when nobody will get operated for nasal polyposis. It will be a single shot treatment. Every year you come and get a shot and you will have no nasal polyposis. This is one of the discussions. And yes, we have discussed one thing, that all doctors are having a very promising future. That was because in 10 years, the allergies are going to increase a lot. There will be more recurrent patients. There will be more polyposis. And on the other hand, we are also discussing that there might be a lot of promising drugs which you can take and totally get rid of the allergy for a specified time period.
Correct.
But yes, lifestyle modification will be coming up. The next thing which will come up is diet, sleep, exercise, and the lifestyle you follow. That proper sleep, smoking, avoid smoking, avoid dust, avoid pollution, avoid damp areas.
Damp areas, yeah.
So that kind of hygiene will also come. What I believe is that India has come out of that, what you say, the requirement of food. Now India is having appropriate amount of grains it can feed to its whole population.
Right.
So we are out of that struggle now. Now the second step will come: health, hygiene, roads, air, environment. Then now this is the first step. Second step we are coming up with. So now people will struggle with that. Now people are out of that grain. Khana do, that is out. Now people will say road do, saaf hawa do, health do. Toilets is already being discussed. A lot of things has been going on there. And every front, it is at least discussion. So it is going up. So that is what is happening is. But still, I will also say that as Indian people, we also need to learn the value of hygiene.
Correct.
Absolutely. It is not that it is his duty to maintain the hygiene. It is my duty also to not litter at least.
So very true.
So that is also very important, that what we can contribute to the society. Absolutely. In that way. And as a doctor, we can advise good way of treatment to the patient. We have discussed that modern science. I think only time will tell what will come and what will not come. I was discussing with my son that my wife told him that quantum physics is one of the things which will be, quantum is coming up. So he told my wife, nobody knows what quantum will come or not. Well, why? Because it is only a software. That is what his words were. It is a software. Whether it will become successful or not, nobody knows.
Nobody knows.
Yeah. It will only time will tell. Again, monoclonal antibodies is one of the talk of the time. I told you we are discussing that single shot. Okay, fine.
So doctor, let's cover some myths and find out whether they are actually true or not. So green mucus is always antibiotics.
No, not necessarily. Green mucus is always antibiotics, because what green or yellow mucus is, it is the inflammatory cells which get collected at the place where there is inflammation. Okay. Altogether, the nasal secretions, the cells, WBC cells, the debris, the dead skin, everything includes make that green.
Okay.
So if it gets cleared, the healing will happen.
Correct.
And if there is infection, actually there is infection, then you will require antibiotics. If it is only the basically the inflammation which is causing, might be rinsing the area,
Okay.
clearing the secretions will only might help.
So the next one being, once you have a sinus, you always have a sinus. Okay.
See, basically,
It's
all of us have sinus. It is only the sinus
Sinusitis,
inflammation,
yeah.
sinusitis, which is called. For this, we need to basically categorize what kind of sinusitis basically you are having. So, if you have acute infection, you will get treated. So, it will not be the same. Once a sinus, always a sinus. Not like that. But if you have allergy, yes, definitely allergies can run for long term. But if taken care of properly, you can get rid of sinusitis. And chronic inflammation, yes, again, your sinuses has deteriorated to a level that they require a very long time of repair and care to heal.
Okay.
So it is in between. In few cases, it is totally wrong, and in few cases, it is right, and in few, it might be the midway.
Okay.
So it is like that.
So the next one is sinus surgery is very painful. Is that true?
See, basically, any surgery is painful.
Okay.
Because when you give a
incision.
basically incision, or you basically pick up the tissue or cut the tissue, it is painful. But most in my case, I do all the sinus surgeries under general anesthesia. So during the surgery, there is no pain. Afterwards, patient is given on medications. Yes, for 2 days, the patient has a blocked nose, totally
Okay.
blocked nose, because of the nasal packs are there. So he feels lot of heaviness in the head because of his totally mouth breathing, and there are packs inside the nasal cavity which act as pressure in the whole area. So that is bit painful, and the pack removal is bit uncomfortable for the patient. A lot of time he has issues with the pack removal. So now we have come up with newer kind of packings which you don't need to remove.
Okay.
So that has become more comfortable for the patient. But yes, blocked nose will be there for 2-3 days. But now there are few packings which have come up, which will only by the rinse they come by themselves. No sinus surgery is not painless. It is not that kind. It is painful, and he needs to take adequate rest for 7 to 10 days, and he has to restrict his physical activities, severe physical or hard physical activities for 6 weeks.
Okay.
So that kind of precaution and rinsing properly and proper medication taken to be properly.
Okay.
That is very important.
So, doctor, how does a platform like One Health Assist help you in your daily consultation or dealing with patients?
See, this is my first exposure to One Health Assist, and they have provided me a platform where I can basically talk of my mind.
Correct.
And you are asking the questions, the right questions. So you have done your homework. That is one of the very good. I was not expecting such a good discussion or scientific discussion.
Okay.
Because on the other side, that not a doctor, ENT specialist is sitting.
Right.
But the question framework were very useful for layman, for patients suffering from sinusitis. So this gives me an exposure to reach to lot many people where I was not reaching.
That's a good thing.
Plus, the second is that this much of information I might not be able to give to a patient
in terms of
in one go, in one consultation. But now I can ask him, go and visit my site, and you can have the all information. You might get clear or 90% doubts about the surgery, about your disease, what is to be done, what is not to be done, what are the local remedies you can take, you cannot take. I can also guide them कि भाई One Health Assist पे जाओ और मेरा पॉडकास्ट देखो और आपको बहुत सारी चीजें क्लियर हो जाएंगी. And jot down notes जो आपको समझ में नहीं है आके मुझसे पूछ लो.
Absolutely.
So that is what of the platform. What I thought was, and you have fulfilled that.
Okay.
And such a wonderful discussion and so detailed, and the questionnaire was minutely worked out.
Okay.
So they have provided me. This is for my first exposure on such kind of thing I have done postcard.
Okay.
So they have given me the opportunity. They are the first one to approach to me that we want to do this with you. So I am enlightened, I am delightful, and I am full thankful to them.
That's great.
Thank you very much.
Thank you.
And I think we will future and also will contribute together in the welfare of the patients.
Yeah, absolutely. This brings us to the end of the podcast. Thank you, doctor, for such a detailed discussion, and we have covered a lot of detailed parameters on sinusitis.
I will also like to thank One Health Assist, Deena, and the team behind the camera team. I will also thank them for they have arranged everything for this podcast to happen. I am the minimal contribution in this. Basically, because this is my field and I know what I need to say. So for me, this was a little contribution towards the society. because these informations, proper informations, if reached out to the proper people, will help them a lot. Thank you
Thank you
very
so
much.
much, sir. Stay tuned and please like, share, and subscribe our channel. Thank you.